everyone, and welcome to our Mother's Health podcast. This is season 2, and we're looking at the Superwoman Syndrome. And the title for today's episode is British Women Don't Complain, which is quite interesting. We're talking about politeness, Stoicism, and the cost of silence. And in Britain, we're taught to queue, and we're also taught to apologize, to manage. There's a culture of silence. And it's not like women don't feel pain, but a lot of women are quietly and silently carrying those pain because they don't want to be looked at as being troublesome, complaining. And today we're going to explore how politeness and silence can delay care and sometimes put our lives at risk. And with me here, I have a very special colleague and friend, and she's no other person than Dr. Jo Heeney. And she's going to be helping me to discuss this because obviously she has a lot of perspective on this subject and also experience as a mother as well.
A baby?
Yes. So she's going to be discussing this topic with me and bringing all her ideas and perspectives. So let's start with you, Dr. Jo. Introduce yourself and we'll take it from there. So you're welcome.
All right, my love. Thank you very much. Yeah. It's lovely to be here with you, Viv. I'm so happy to be able to support you with your amazing series of podcasts. For those of you, excuse me while I just grab this tea. Those of you that don't know me, I'm one of the senior lecturers from Arden, and I've been with the institution for just coming up to about 5 years now. Before that, I've had loads of different jobs, but my background is in youth work and social work, PhDs in sociology, and my research interests are kind of around parenting, really, and male parenting. So I think this just looks really interesting, Viv, and I'm really happy to be able to support you and join in with this initiative. It sounds amazing.
Thank you, Jo. Thank you. So share with us, I've talked about the British culture of silence. Have you had any experience like this? Just share with us your pregnancy experience.
I think some of it is the British culture of silence, but I think some of it, probably a lot of it, is about expectations of women and for women to be strong and just crack on with things, particularly around stuff to do with pregnancy-related stuff, sexual health stuff, anything to do with care of the body parts that make other humans, really. And my kids are older now, so my eldest is nearly 22 and my daughter's 18, but both of my kids were emergency cesareans, and one of the things that I did notice was just a huge amount of pressure to not be ill and not be tired and not be in need of someone to give you a bit of a cuddle and tell you that it's going to be all right. And it's difficult now for people that have cesareans because I know that the stays in hospital are much shorter now than when I went. So when I was having my kids, it was 5 days. But now people are just sent home from hospital. There might not be enough care for them. They might feel that they can't say, well, I'm struggling, this is really difficult, I'm in pain, I'm upset, I'm in shock, which for a lot of women, once they go through childbirth, is a really shocking experience. Nothing can prepare you for it. But then when you come out the other side of it, it's just like, you've done that now, just crack on. Yeah. Don't be complaining. Yeah.
So did you ever feel any of your symptoms during pregnancy, symptoms such as pain or anything that is concerning were downplayed by the healthcare system?
A little bit, but it wasn't. I don't think it was necessarily to do with the system or the quality of the care. I think it was probably more to do with demand on the system, which I think even going back 20 years, it's been a problem. So when I went in to have my daughter, my second pregnancy, I didn't know, but I had something called obstetric cholestasis, which is where you get really itchy because your liver's not working properly. Yeah. And I didn't like going into the hospital anyway. And it was also my birthday. But I knew that there was something not quite right. So in the end, my husband took me in because I just literally could not stop itching. And the doctor came in and he said, are you sure you're more itchy than what a normal person would be itchy? And I was like, look at my legs because they've started to bleed where I've been scratching them. And so anyway, to cut a long story short, they did some blood tests and they said, I've got this condition and you need to come in. And then I had to go in. I can't remember. I think I had to go in every day to go on the monitoring machine, and I had to have some big, massive injections in my bum, which I don't actually know what they were, but they made me go mad, and I was up cleaning the house at 4 o'clock in the morning and stuff like that. I think they were steroids, and then they just needed to get my daughter to 37 weeks so that they could then deliver her. But it was a really scary time, and I wasn't given a great deal of support, and there was no follow-up afterwards. So after I had the baby, there wasn't really anyone that did any kind of checks to see if my liver function had come back down to normal and stuff like that. But at the same time, I really appreciate how difficult it is for people that work in those systems. But I think because I've got that perspective, that makes me complain less. So I understand the position that the people that work in those professions are in.
Yeah. So the system forces you not to complain because you feel bad somehow. You think you understand the pressure on the system. And many women are in this situation. You just feel like they shouldn't complain. They just feel like they shouldn't express how they feel because they know there's a pressure on the system and all of that, which is quite a shame because if you're facing something serious and you don't complain, the consequence can be devastating in the long run.
Absolutely.
And this is the experience of many women. They feel like they shouldn't complain. Let's just get on with it. Let's just do it. You get what I mean? And it's quite sad to hear you felt like you shouldn't complain.
Just crack on.
So thank you for sharing your story, Joe. That was for just sharing it and just be open like that, because I'm sure it's going to help somebody there. What we're doing and what we're discussing, help women to encourage them to complain, to share their story. Because
absolutely,
it's
so difficult.
Silence. Especially in Britain, people are very polite. They're just afraid to share their story or complain or do anything like that. Like you said again, you talked about the NHS, the system being the burden on the system. We are all aware of the burden. We're all aware of the huge waiting time. And let's talk a little bit about that. Many women tell us they are worried about wasting the NHS time. I can hear from you had a little bit of that feeling, how there's a burden on the system. So let me not give them my own burden. Let me just deal with it. Did you ever hesitate contacting the midwife or GP because you felt like I shouldn't complain? Did your politeness stop you from insisting when you felt something was wrong?
It's really difficult, I think, with motherhood because as mothers, we're expected to be perfect. And at the same time, we have to be experts in our own bodies and in the care of children. We're expected to know all of that. But at the same time, we're expected not to complain, not to ask for help, just to get on with things. And just what you said earlier about people in the UK just not complaining and just queuing up for things and just getting on with things. After I had the children, I think that was probably worse than when I was actually physically giving birth to them, because I was so lonely. I was so isolated. I didn't know if anything I was doing right was wrong. I didn't know if the things that were happening to my body were normal in terms of the recovery. And once I could go out, I used to just go to places where they were in supermarkets and stuff like that, because I knew that nice old people would come and talk to me. And that's because I was so lonely that I knew if I went and sat there with a newborn baby, that somebody who wouldn't know me would just come up and start a conversation with me. And I learned a lot from elder women that I didn't necessarily know, but they helped me to get through it and feel a bit normal, really.
Oh, that was quite nice that you could find that community. And a lot of people do not have that opportunity to socialize with people in that way because maybe they don't have family, they don't have friends, they've not built those relationships or even have the boldness to just go and socialize with other people. Just go. Not everybody have that kind of, but that brings me to the point that as women, we shouldn't apologize for asking for help. We shouldn't feel like we have to do it alone. And a lot of people find themselves apologizing when they need help. But I know you, Joe. I know that when you need something like that, you have that confidence to say, I need help, which is very good. Social skills that you have there. A lot of people don't have these, and it can be quite problematic.
Oh, there's a huge stigma, particularly for mothers, I think, about asking for any kind of help or admitting that it's almost like, I think there is an assumption somewhere along the lines that this just comes naturally to us. And it really doesn't.
I think I had a similar experience. I was having my child and I was in the hospital, and I'm also on the quieter side, and I was just so polite to the doctors and the nurse. I didn't want to enforce anything, just following as they say and everything. But across the room was another woman, and she was complaining, I need this done, I'm going through this pain, and she was trying to demand for what she thought she needed. And I overheard the nurses saying, what a terrible person. She was labeled terrible, she was labeled all sorts, and they told to me, you were a nice person because you're quiet. You're so nice because I was not enforcing my rights. And that brings me to say, so often women are described asking for care as though they are asking for favor rather than exercising their rights. Because if somebody is feeling pain somewhere, she's telling you, help me. And she said it once, she said it twice. And I knew the woman has said it a few times. And then she went off to say, now I'm going to pull down this building to get what I want. And she was labeled all sorts of, I could hear them. They didn't say it to her face, but I could hear them behind saying she was a difficult person. She was not a nice person. But you can imagine the pain people are going through and the fear and the anxiety people go through. During those.
It's not just the physical pain, it's the worry and it's the fear. It's a really frightening thing. No matter how many times you've done it, it's still frightening.
Now, I want to ask you another question. Were there moments where you stayed quiet, even though something didn't feel right?
There was. With me, I think I could have been more of an advocate for myself, but also I was just so overwhelmed by the environment of being in the hospital. And I remember being there, and it was the first night I got admitted, and there was a lady on the ward next to me, and it was a ward with curtains round the bed. So I was in hospital in Liverpool, and this lady had been brought in from Manchester. And the reason that she'd been brought in was because she'd gone into premature labour very early on in a pregnancy. And I don't think there'd been any neonatal care available in Manchester, so they'd had to bring her over to Liverpool. And she was asking, I could hear what the consultant talking to her, and she was telling her that a baby had been delivered but was very premature and might not survive, and it was a horrible conversation. And the patient was asking the consultant, would it be better if she saw the baby or not, if there was a chance that the baby might not survive? I remember thinking, why are you having this conversation with that woman on a ward where I can hear? So, and it's such a sensitive topic. Shouldn't there be a counsellor or someone that talking through these things with that lady? And it shouldn't be, your baby might live or your baby might die. Do you want to look at it or not? I just thought it was very cruel. Everything about it was cruel. And I often wonder about what happened to her and what happened to the baby. But I just remember thinking at the time, this isn't right, this really isn't right, what's happening to that woman? I suppose that made me feel better about the things that happened to me, because I thought, that's really awful.
So did it stop you from pushing for your own care and seeking what you wanted? Seeing that and being in that room.
I just wanted to get out of the hospital, Viv. I just wanted to get the baby, get my kids out of my belly, into that car seat and back to my house. If I'm perfectly honest, I just wanted the professionals to just discharge me and let me just crack on now, because I wasn't finding it helpful.
So were you perceived as being dramatic or anxious? Were you labeled difficult at any point during this pregnancy? No.
I don't think so.
You weren't anyways.
I think when I had the eldest, it could have been done differently because he was facing the wrong way up and there were all kinds of problems with his positioning, and I probably shouldn't have been allowed to labour for as long as I was, because it did go on for about a good day and a half. And for anyone that's ever had a baby, it took me a day and a half to get to 1.5 centimetres dilated.
That's quite a long time.
So I won't be taking it up as an Olympic sport. But you know what? I felt every single one of those contractions. And then obviously it wasn't going to play out the way it should have done. So maybe, but I don't know. I just think the doctors and the nurses and the midwives and the obstetricians, they're the experts. And I didn't want to challenge what they thought was the best thing.